Hi, this is Tricia Hannick, the Director of Quality Improvement for HSHS ACO and the Physician Clinical Integration Network. Today I'm going to talk to you about the preventative health domain measures for 2017. Just as a disclaimer, Medicare has neither reviewed nor endorsed this information. The first measure that's part of the preventative health domain is ACO 14, which is influenza immunizations. This is a pay-for-performance measure for 2017, so we at least need to be in the 30th percentile on the benchmark in order to be eligible for shared savings. This is for patients 6 months and older. They need to have been seen for at least 2 visits or 1 preventative visit between October 1 of 2016 and March 31st of 2017. They also need to have received the influenza immunization, or a reported receipt of the influenza immunization needs to be documented in the electronic health record. Exceptions to this measure are a medical reason such as an allergy to eggs, patient reason, meaning they refused or declined, or a system reason such as the vaccine wasn't available. But keep in mind all of this must be documented in order to show CMS if we're audited. The next measure that's part of preventative health domain is the pneumococcal vaccination. This also will be a pay-for-performance for 2017. This is for patients 65 and older who have had a visit in the measurement period. They need to have received the Prevnar or the PPSV 23. Now, the order and timing of the vaccination depends on certain patient characteristics, and those are described in more detail in the ACIP recommendations. But for this measure, CMS just requires that one or the other has been administered to that patient to get credit. The next measure, ACO 16, adult weight screening and follow-up. This, again, is part of the preventative health domain. It is a pay-for-performance measure for 2017. This includes patients who are 18 to 65 and older with 1 visit during their measurement period. The BMI must be documented during the most recent encounter or during the prior 6 months. If the BMI is abnormal, there must be a documented follow-up plan during the visit or within the prior 6 months. Now, CMS has normal parameters that are considered normal would be greater than or equal to 18.5 and less than 25. That's the normal parameter. If they're not in that, they're either lower than 18.5 or greater than 25, there needs to be a follow-up plan. So it should be a documentation of treatment recommendations. And examples of what will be accepted for this measure as far as a follow-up plan include documentation of education, a referral, for example, to a registered dietitian, a nutritionist, an occupational therapist, a physical therapist, a primary care physician, an exercise physiologist, a mental health professional or surgeon, pharmacological interventions, dietary supplements, exercise counseling, or nutrition counseling. The documented plan must be based on the most recent abnormal BMI. There are some exclusions to this measure, which include pregnancy, palliative patients, refusal of height and weight, or refusal of treatment. Exceptions include those patients who are 65 or older with potential complications like illness, disability, dementia, nutritional deficiency, or emergent patients. But keep in mind these have to be documented in order to get credit. The next measure, ACO 17, tobacco use screening and cessation intervention. This is again part of the preventative health domain. It is a pay-for-performance measure for 2017. This is for patients 18 and older. They need to have been seen for 2 visits during the measurement period or at least 1 preventative visit. They need to be screened for tobacco use 1 or more times within the prior 24 months. And if they are indicated as a tobacco user, they should have received cessation counseling intervention, and it must be documented in the medical record. If the patient uses any tobacco, they smoke or use smokeless tobaccos like e-cigs, snuff, chew, all of that, with those, the expectation is that they are provided tobacco cessation intervention, and that can include counseling and or pharmacotherapy. Exceptions to this measure include documentation of the medical reason for not screening, such as a limited life expectancy or other medical reasons. The next measure, ACO 19, colorectal cancer screening, again part of the preventative health domain. This will be a reporting measure only for 2017, meaning we just have to show that we can accurately and completely report on it. This measure includes patients aged 50 to 75 with a visit during the measurement period. They need to have had an appropriate screening for colorectal cancer, and those include one of the ones below: a fecal occult blood test during the measurement period, a flex sig within the last 5 years, a colonoscopy within the last 10 years, a computed tomography or colonography within the last 5 years, a fecal immunochemical DNA test within the last 3 years. Documentation in the EMR must include both the date of the screening and the results, and they will allow documentation of abnormal or normal. If a patient reports that this test was done, you need to have documentation of the date they had it done, and it can just be the year, the type of the test, and the results. This screening can be completed during a telehealth encounter. And exclusions for this measure include patients with a diagnosis or history of a total colectomy or colorectal cancer. The next measure, ACO 20, mammography screening, is again part of the preventative health domain. This is a reporting measure only for 2017. This is for women aged 50 to 74 who had a visit during the measurement period. They need to have received a mammogram to screen for breast cancer within the prior 27 months. Documentation in the EMR must include the date of the screening performed and the results. They will accept abnormal or normal. If the patient reports it, remember you have to have the date, even if it's just a year, the type of the test, and the results. And this screening can be completed during a telehealth encounter. Screenings include a breast x-ray, a diagnostic mammography, a mammogram, or a screening mammogram. And CMS got a lot more specific regarding what tests that they will allow as acceptable for this measure. They will not consider an MRI or an ultrasound as the breast cancer screening. Exceptions to this measure are for patients with bilateral mastectomy or 2 unilateral mastectomies. And the last measure I'm going to talk about is ACO 42. This is statin therapy for the prevention and treatment of cardiovascular diseases. Again, part of the preventative health domain, it is a reporting measure only for 2017. Patients who are in this measure are high risk for cardiovascular disease. They can include patients 21 and above with an active or prior diagnosis of cardiovascular disease, patients 21 and above with any instance of a fasting LDL-C being greater than or equal to 190, or with active or prior diagnosis of high cholesterol, or patients 40 to 75 with diabetes diagnosis and a fasting direct LDL-C of 70 to 189. They need to meet the numerator, the patients need to be prescribed or on statin therapy during the measurement period. Exclusions to this measure include pregnancy, breastfeeding, and the rhabdomyolysis, I don't say that very well, and exceptions are documented adverse effects such as an allergy or an intolerance, palliative patients, diagnosis of active liver or hepatic disease or insufficiency, diagnosis of end-stage renal disease, or diabetic patients with an LDL-C greater than 70 and not taking statin therapy. This concludes my presentation. If you have any questions, feel free to reach out to me, Tricia Hannick, at 217-757-3164. Thank you.